Hello, this is a short video presentation regarding the pathophysiology and medication management of Parkinson's disease. Parkinson's disease is caused by a continuous loss of neuron called dopaminergic located in the substantia nigra, followed by a formation of Lewy bodies in remaining neurons. Dopamine is a neurotransmitter that plays a role in sending signals between neurons in the nigrostriatal pathway, which controls body movement and learning. Furthermore, Lewy bodies are circular, eosinophilic intraneuronal particles with a pale peripheral border and a hyaline core composed of approximately 90 proteins, with the majority of ubiquitin and asynuclein. Intracellular inclusions occur when alpha-synuclein misfolds, turns insoluble, and forms beta-sheet-rich amyloid aggregates. The toxic oligometric and protofibrillar forms are the intermediates in the aggregation process, causing damage to membrane, cell framework, mitochondrial function, and neural degeneration. Alpha-synuclein accumulation and formation of Lewy bodies interfere with normal neuronal function, including mitochondrial function and proteostasis of protein management process that could result in cell death. It is estimated that up to 60% of dopaminergic neurons were already destroyed at the time of diagnosis. When dopaminergic degenerates, dopamine production causes communication disturbance between neurons. Tremor, rigidity, bradykinesia, and postural instability are its primary neurological symptoms. On the contrary, pain, trouble sleeping, depression, anxiety, fatigue, and cognitive decline are a few of non-neurological symptoms. Non-neurological symptoms may appear due to neuron degeneration in other brain areas besides substantia nigra, including serotoninergic, cholinergic, and noradrenergic systems. Parkinson's disease is a progressive condition and in advanced stages. Patients may have significant difficulty in moving. Alpha-syn is a disordered protein. It progressively grows throughout the brain, known as Bragg stage. Initially, the damage begins from the dorsal motor nucleus and ascends to the brainstem and neocortex. As to why it happens is still uncertain. However, the best explanation at present is there is a variance between its synthesis and clearance. Oxidative stress is a harmful condition caused by an imbalance between reactive oxidant species creation and detoxification. This problem leads to damage to cellular function. Furthermore, it is widely recognized that the mitochondrial respiratory chain is the main source of ROS. Stress-induced apoptosis, formation of ROS, and decrease in energy output can all be caused by mitochondrial breakdown. On the other hand, mutations in certain genes and mitochondrial DNA may create issues with mitochondrial fusion, which in response can lead to mitochondrial failing to work and develop Parkinson's disease. Levodopa is one of the main medications for Parkinson's disease. It is part of the dopamine antagonist drug class. So the mechanism of action is dopamine is released and absorbed from the gastrointestinal tract, passes through the blood-brain barrier or BBB, picked up by neurons and converted into dopamine by an enzyme called aromatic amino acid decarboxylase. Parkinson's disease symptoms are triggered by the abnormality of the nigrostriatal pathway, which lowers dopamine level. Therefore, the central dopamine receptors will be activated by the dopamine from external levodopa, relieving the symptoms of Parkinson's disease. Since levodopa has a short half-life of 36 to 96 minutes, which may cause fluctuations in plasma levels. It is required to be injected numerous times daily. Levodopa treatment reduces bradykinesia and other common motor symptoms associated with Parkinson's disease. In contrast, long-term levodopa treatment can lead to side effects such as dyskinesia, motor fluctuations, which significantly lower quality of life. Levodopa are usually used alongside carbidopa, and we need to be careful of the dosing schedule and managing the side effects of these two drugs. There are a few nursing considerations related to levodopa. Firstly, levodopa has a short half-life and needs to be administered multiple times daily. Thus, nurses have to ensure the medication given is on time to prevent off periods. Furthermore, nurses need to monitor for any side effects that may result in consuming levodopa, such as nausea, vomiting, and dyskinesia. If it persists, adjusting the medication dose might be necessary. Lastly, levodopa and protein are both absorbed in the intestine. Therefore, nurses need to instruct the patient to take levodopa 30 to 60 minutes before meals or several hours after meals to increase absorption and effectiveness of the drug. As we went through the pathophysiology, pharmacology, medication management, and consideration of Parkinson's disease, it is crucial to understand how the Parkinson's disease progresses so we as the healthcare professional can optimize our medication management given to the patient.